Yeah, we are live. You can start.
Okay.
No, no.
Good evening, friends. Jai Bhim. I am Amarkant. I welcome you all on behalf of Ambedkar Periyar Phule Study Circle, IIT Bombay. It's a great pleasure to welcome our speaker today. Dr. Sylvia Karpagam is a public health professional and researcher working on the right to health and right to nutrition. She is interested specifically in social determinants of health and nutrition and in regulation of the private health sector. She is active on social media as she is on ground, shaping discourses around healthcare and nutrition. The science of nutrition should not overlook the socio-political and economic factors in our policy making, planning, and research. Let us now hear from Dr. Karpagam on the nutrition policy from the lens of caste about erasure and criminalization of animal source foods. We hope this will help us understand better the prejudices and discriminations around the subject. We welcome you, Dr. Karpagam.
Okay,
Thank you
ma'am. You
so
can start.
much. Yeah, thank you so much. And also thanks to the Ambedkar Periyar Study Circle for having these kind of discussions, which are very crucial. My today's topic is on looking at nutrition policy from caste lens. Just to say that I think most policies should be looked at from the caste lens, but this time we'd be looking at the nutrition policy. Just to give a context, sorry, yeah, okay. So if you look at some of the nutritional indicators in India, they are actually a cause of concern. We have high levels of, um not only generalized nutritional deficiency, which we classify as stunting and undernutrition, but we also have very specific deficiencies of several vitamins and minerals. And each of these together and also in isolation can cause several complications, clinical complications, both short term and long term, both preventable and irreversible. So, for example, vitamin A deficiency, in the initial phases, it can cause night blindness, it can cause increased respiratory infections, it can cause diarrheal diseases. But as it keeps, if it's not treated, then the child can actually go on to permanent blindness. And in fact, vitamin A deficiency is the largest cause of preventable blindness in India. And similarly, with most of the other nutrients, there are several, clinical consequences. And these are some of the indicators which show that among 2 to 4 year old, only 5% consumed vitamin A rich foods the previous day. The consumption of eggs and flesh foods is very low among the food groups, and only 21% had a diverse diet. And by diverse diet, we mean at least four or more food groups. We'll be talking a little about that later. And only 9% children in the age 6 to 23 months received iron rich foods. So this is, even before the child is 2 years, the child is already having diets which are poor in most of the nutrients. And this only gets worse with age. And there are certain groups where the need is more. For example, as a child is growing, or if someone is sick and when they are recovering, or in pregnant and women who are feeding, all of them have extra nutritional requirements. This data is from the National Family Health Survey, which shows that in rural areas, children less than 5 years have stunting of almost 37.3%. So basically, these children are not reaching the heights that they're expected to reach. And undernutrition, that is, the expected weight for age, is almost 33.8%. And again, all of these have severe consequences, both as a child, where the child becomes more prone to a lot of other infections like diarrheal diseases, respiratory infections, slow learning, difficulty in concentration, and a host of other complications. But also in later years, as they grow into adults, they are more at risk of non-communicable diseases, including heart disease, obesity, diabetes, and hypertension. And this is something that you will find a lot of researchers will put out these kind of statements where they say that the SC, ST, OBC children are more likely to have stunting and undernutrition than children who come from the so-called vegetarian or oppressor caste groups. Now, this is data. This is what we find. But what is very important is how this data is interpreted. So if you look, very often the judgment is put on the communities. People might say that, Dalit mothers are too busy, or Dalit men do not take care of the families, or there is a lot of judgment that is passed based on this data. I mean, it's not so obvious as what I put here on the screen, but definitely that is implied where they say, Dalit, parents spend less time with their children, or they, they're less educated, they're less involved in feeding or caring for their children. And in contrast, they also then tend to say that vegetarian food is better, vegetarians are more intelligent and smarter, hardworking. These are the kind of things that you will see in how this data is interpreted. But if you actually look at it, a lot of factors actually influence nutritional outcomes. Some of them are well known. I think we all know. I mean, ideally, I would have preferred a face-to-face interaction where we could have discussed this, but yeah, because it's Zoom, I'm just putting it out there. Basically, a person's education. We know that the more educated a woman is, the better her own health and nutritional outcomes, the better that of a child, the less chances of a child dying. And she gets married later, and the later the age of marriage, the better the health outcomes for both the women and the children. Also, livelihood plays a role, occupation plays a role, the geographic location, as we saw, the rural, urban, whether you're living in an urban slum or whether you're living, in a posh locality, all of those can make a difference in your nutritional outcomes. Class makes a difference, gender, religion increasingly is showing a difference, sanitation, and these are some of the things that the data itself shows. But what we also have to look at is the factors which are not so well known. And some of these, I think it's important that we discuss these. So one is that you have vegetarianism, but it's not a uniform kind of vegetarianism. So people who come from, oppressor caste groups who opt out because of family or caste reasons, or various other reasons, to they opt to be vegetarian. The kind of vegetarianism that they have is actually quite nutritionally adequate, because there's food from different food groups, there's diversity, there's good quantity, and importantly, there's also, uh, like what I said, diversity has to have food from different food groups. So they do have foods from different food groups. Let me just go to that now. Oh yeah, okay, forget it. It's not moving. Yeah, so you have diversity. Basically, you have you should have at least four major food groups from these six groups. So the one group is cereals and millets, which is basically all your rice, ragi, wheat, jowar, maize, barley, rye, depending on which area you come from. You also have the pulses and legumes, which are your dals and the peas and the rajmas and the chana and soya and all that. You also have milk and dairy, which is a separate food group. Then you have the meat, poultry, fish, eggs. Then you have fats and oils, and you have vegetables and fruits. So, though people might claim to be vegetarian, but they will have most of these food groups, and including milk and dairy, which is, if you look at it from kind of a nutritional scientific framework, then it is a animal source food. It's not a plant based food. So So yeah, wait, let me go back there. Yeah, yeah. So this the problem is that the one group which opts by choice to be vegetarian is the group that is often deciding the policies for the country, which is often making decisions for the country. And there is a tendency, because of the whole caste nature of vegetarianism, to glorify this idea that India is vegetarian. A lot of people in the West and outside countries think that India is vegetarian. And that is not based on data, because what data shows is that only 20% actually self identify as vegetarian, and even they consume animal source foods like dairy. So strictly speaking, even they would not classify as vegetarian. But the food that is imposed on the others is mainly from one food group, and that is cereals and millets. And this can be seen across all the social security schemes, whether it's the ICDS, that is the Anganwadis, whether it's the midday meal scheme, whether it's the public distribution system, even the demands from activists or right to food groups. It's mainly about cereals and millets. Very little discussion. At the most, maybe they'll talk about pulses and oils, but there's complete erasure of a lot of the animal source foods. And if you see many of the policies, which you technically shouldn't be calling policies, it's rather than coming from a scientific or a nutritional basis, they are mostly framed from a ideological, political, caste, religious, and now increasingly animal rights and from a climate perspective. And the solution is often dependent on the pharma, because they tell you, if you have iron deficiency, if you have anemia, just take iron tablets. If you have vitamin A deficiency, just take vitamin A syrup. If you're have any B complex deficiency, you just take B complex syrups, or they come up with corporate dependent solutions such as fortification, which are very much focused on single deficiencies. And it's important to understand, in a country like India, it's very hard to find isolated deficiencies. So if, like for example, I showed you the statistics about vitamin A, it is quite high, the deficiency. In that instance, you will not have only vitamin A deficiency. The chances are that in that population, there'll also be a high level of stunting, there'll also be anemia, there'll also be a lot of other deficiencies. So just replacing one nutrient is not scientific. And that's what the government tends to do, because A, it's a simple and easy solution, and B, it's corporate. It pushes the solution to the corporates, which is again problematic. You also have disproportionate control of misinformation. Basically, you have a whole bunch of people who are in power, who are giving you a wrong information about nutrition. So if for example, a patient goes to the doctor and doctor diagnoses anemia, the doctor is going to tell the person, eat your tablets and eat your fruits and vegetables. Now, the fact of the matter is that the best source of, the best way to address anemia, prevent anemia, treat anemia, of course, if it's very severe, you have to intervene medically. But if it's, borderline, or if you want to prevent anemia, then you have to, the diet that you have to advise is definitely not fruits and vegetables. The best sources, which we learn as doctors, so it's not something that is, mysteriously, it's handed down, I don't know, through meditation or something. It's something that you get because you're reading your textbooks and you're reading literature and you're reading, journals, which says that like organ meat is the best source, or nutrient dense source to prevent and treat anemia. You also have red meats, which are a very important source. A lot of the animal source foods actually are nutrient dense. But this doesn't come across. Doctors will not tell you this. In fact, you go to the doctor with any health illness and they'll tell you give up meat. That will be their first, recommendation. They'll say give up eggs, and then they'll say eat fruits and vegetables. And this kind of misinformation is again spread by a lot of people. Whether it's, I'm sure you must be seeing in your own universities and colleges, faculty spreading this kind of information, which doesn't come from science, but it's probably comes from what their grandparents have told them, and which they're just repeating here. And in fact, the national education policy actually said that grandma's knowledge is very important. So again, it's very important to ask who's grandma. Is it a Dalit student's grandma who's very much plugged into nutrient dense foods, or is it a curd rice eating grandma who's only going to talk to you about curd rice? And also a lot of laws, meat bans, segregation, criminalization, discrimination, which is happening of nutrient dense foods, which are again implemented and legalized by lawmakers and elected representatives. These are what actually affect and adversely affect our nutritional outcomes. And so, like I said, these are some of the nutrient dense foods. You have liver, except human and other banned animals. You can eat liver, which is a very good nutrient dense food. You have red meats, of course, poultry, fish, dairy, eggs. All of these are considered as nutrient dense animal source foods. And again, these have most of the essential nutrients. They are very good quality. Um, so saying that, say for example, soya has a lot of protein, it doesn't make sense because the protein is not digestible, it's not of good quality, it's not bioavailable, as compared to say eating even smaller portion of nutrient dense food. And similarly, it has better quality vitamins, minerals, fats, essential fatty acids, and a lot of other nutrients. It also has less phytates, fiber, and tannins, which are present in plant based foods and therefore prevent absorption even of those nutrients that are present in the plants. And nutrient dense foods, animal source foods, are cultural, also traditional, which often erased. So if you see some reviews, they'll talk about Indian culture and they'll say Indian culture is idli vada and sambar and I don't know, like some very vegetarian kind of foods, and completely erase the rich traditional foods that we have in the country. Again, that comes very much from a caste and religious location. Also, it's important to understand these nutrient dense foods support local livelihoods and economies. You have the pastoral communities, you have a lot of people growing poultry, you have a lot of people, fisher folk who are dependent on the fishing trade. And therefore there's less dependence on the corporates, and these foods are much superior than some of the newer foods that are being pushed. For example, you have the lab based meats, you have the fortified foods. So these naturally occurring nutrient dense foods are far superior in terms of nutrition quality. This is just to give an example of the nutrients provided by 100 grams of lean beef. Basically, it gives look at on the right side, you can see the percentage of the daily requirements, which is quite impressive. And like I said, we have this whole nutrition, which is based on ideology, politics, rather than science. And so, to go through some of those which are actually, causing nutritional crisis in the country. So you have Akshay Patra, which I don't know how many of you know. They've been given the contract to provide the midday meals across the country in different states. They come with a clear ideological and caste agenda. So, for example, this is some of the quotes that you can see where they basically reaffirm the caste system, and they, in fact, say that it is of value. They talk about natural talents and abilities and giving work according to a person's qualities. And we know how this translates in the way Dalit students, children from Adivasi OBC communities are treated, in spaces like IITs, IIMs, even in medical education, constantly being told that you do not belong to these spaces. You belong to a caste group that is meant to provide not just service but also to do unclean kind of activities. And this is being reinforced by organizations that are giving food to children, and this translates into the kind of food that they give in their attitudes. And also there's a lot of indoctrination that is happening. We know that children are being told that sattvic food is better for them if they want to study well, if they want to concentrate better, if they want to perform well, then they have to eat sattvic foods. But the if you look at it scientifically, there is very little nutritional value in these sattvic foods. And all those nutrient dense foods that I told you are scientifically proved are classified as tamasic. And this is a kind of food that is being given to children in the midday meals. It's also important to remember that a lot of these children in government schools are actually from Dalit, Adivasi, and OBC communities, and most of the people who oppose meat or eggs in the midday meal scheme are people whose children don't study in these government schools. So that is the irony. But it's also that these groups also push for a kind of a homogeneous food, where you say, one food, one nation, one ration card, one language, as though homogeneity is something to be valued. Whereas, in fact, diversity, as with foods, diversity is what brings stability and growth into any kind of system. There's also a capture of state power, which is very important, because irrespective of the criticism, there's been allegations of serious corruption and not following the even state guidelines. These kind of organizations have huge amount of power. It's literally a capture of the state power. And Yeah, the eggs are considered to be, scientifically, if you look at eggs, they're considered to be a complete food. Basically, if you give eggs, you can be sure that you'll meet most of the nutritional requirements of both children and adults. But again, a lot of taboos around egg, a lot of misconceptions. People say it's the menstrual discharge of the hen, and criminalization. I'm sure you must have heard about how there's been opposition across different states to giving eggs in the midday meal scheme, in spite of malnutrition being so high among the children who attend these government schools. And also culturally, a lot of these children actually eat eggs. More than 92 to 95%. Not only do they eat eggs, but they enjoy eating eggs. But there is so much of opposition to eggs being given to these children.
Yeah, I think you can continue.
Okay. So basically, can you pause the YouTube thing? Yeah. So as we all know, there's increasingly attacks on people for their choice of food. Um, and We have the cattle slaughter bans in different states. Again, there's no scientific basis for the cattle slaughter bans. There are enough evidence that uh, these bans actually they create other complications. They create stray cattle. They reduce even the milk production. They affect people economically, and it's not thought out. It's not thought through, and it's not based on any kind of science. And it's definitely targeted at Muslim and Dalit communities. It destroys livelihoods. We have done a report on this, so I can share that if you want the link to that, on how across the board, whether it's the farmers, whether it's the people who are transporting what they've legitimately bought, cattle, the slaughterhouses, the butchers, the people working the leather in the industry, the people who are working with the curing and hide related activities. All of them have been affected overnight by these cattle slaughter bans, and there's been no alternative livelihood that has been offered to them. And if you look at those little screenshots that I put, it's the language that is used is completely to make it illegal. What is a legal occupation of people for generations has suddenly become illegal. Use words like seizing and arresting and smuggling, booked under. And so basically, you're making people into criminals for doing occupations that they've done for generations without offering any kind of alternative. There's also definitely an increase in extortion, an increase in the raids and attacks on people, increase in police violence, and gundaism. This these are some of the images of the entire economy of the cattle trade being affected because of the cattle slaughter ban being brought in overnight. And this particular clause I thought was particularly interesting because it actually says that you can go and beat up someone, you can attack someone, and you can lynch someone, you can go in mobs, you can abuse someone, and you will be considered as person or persons acting in good faith, and you will not be prosecuted. So this is the kind of unscientific nature of these kind of laws, which come only because they have a caste or a religious capital to support them. And this, I think, we all know. I had put this IIT Bombay even before, so I didn't put it now. Basically, a lot of these spaces, uh, promoting what we call food casteism or food imposition or food fundamentalism or food fascism. Basically, what you can call a vegetarian fragility syndrome. So basically, the vegetarians are so fragile that not only they do not want to eat foods like which they consider as polluted or impure, but they don't want others also to eat it. And there is this exaggerated, like I said, fragility. You don't want to sit at the same table. You don't want to eat in the same kitchen. In fact, the national education policy said that people who eat meat and eggs are discriminating against those who don't eat, because they don't like it, and if you eat it then you're discriminating. So it's basically victimhood taken to another extreme, and reversing the whole idea of discrimination. If you look at what actually you know food imposition means, it means that people have a choice not to eat or eat what they want to. That's completely up to them. And they they have a right also to talk to others and tell them, but they have no right to make decisions, make policies, criminalize other people, abuse other people, and by holding power and abusing that power to prevent other people from
Uh, Dr. Karpagam, can you hear me? I think there is an issue with the connection. We'll be back once the connection is restored.
Can you hear me?
Yeah, we can hear you.
Sorry, where did I get cut off?
So you were talking about the vegetarian fragility syndrome.
Oh yeah, okay. Yeah, so you can see my PowerPoint, right?
It's not come yet. I think you have to
Yeah,
screen
no, I
share it.
think my power went off, so I'm sorry about that.
Yeah, that's fine.
Can you see
Yeah,
it?
we can see it. Yes,
Yeah,
ma'am.
so basically, having different entrances, different kitchens, different plates, sitting separately, um, uh, and also not allowing people to eat. Like for example, a lot of the public institutions, a lot of hostels, airlines, many of them are not being allowed to serve meats. So this comes again like from a very caste and ideological and political basis rather than any kind of sound science. You also have the multinationals across the globe who are using this, this idea of India being a vegetarian country to push for what they call the plant-based foods. Again, very corporate dependent. And there's a lot of appropriation of language, which you can see here, which is used as a way of, pushing for corporate-led solutions to malnutrition. And also control of food systems by the large corporates. So it's important for us to look at some of these decisions that are being made on behalf of us and see whether they really can be classified as policies. So, for example, if something has to be a policy, it has to be evidence based, it has to be scientific, it also has to be representational. So, for example, with healthcare, you might have a lot of corporate hospitals being set up in urban areas, charging a lot of money, but definitely they're not representing the majority of the needs of the majority in the country, and definitely there's no diversity. So again, that's I think very important to look at in the context of nutrition. And many of these systems decisions, are they accountable? For example, with the COVID pandemic, certain decisions were made, like for example, shutting down public hospitals or converting public hospitals into COVID facilities, because of which a lot of the other non-COVID diseases went up. Who was held responsible? Has anyone been pulled up for this? Again, these have been documented in clear terminology, or are they deliberately left vague? Are they realistic? Are they people centered, and do they come with an agenda? Unless these decisions meet some of these criteria, then they shouldn't actually be called policies. So just to say that sometimes when we look at data, we often look at the outcomes. Like we might say these issues are more in the Dalit, Adivasi, or OBC communities, but we also, I think, importantly need to start looking at why these communities are not you know why the indicators are not improving. Why is there so much malnutrition? Is it the communities itself that should be blamed and held responsible, or is it the systems that keep these oppressions in place, the decisions that reinforce these kind of oppressions? And yeah, so that's the end of my presentation, and we can have a discussion.
Thank you, ma'am. Thank you so much for this enlightening presentation on how even vegetarianism is being weaponized as a policy to make the more, or to on or imposed on the 80% of the population who have been historically eating meat, and how they are made to feel that uh, there is something wrong with them in some sense, and even completely sidelining the nutritional aspect of how we as a nation is facing this big nutritional crisis, and how they are completely sidelining it and imposing this political agenda, and how it is going unopposed. So recently we saw an article in the news that how in Karnataka, after the midday meal scheme, so they were thinking of removing eggs from the midday meal, and finally now that they have implemented it, there has been an increase in the number of students who are actually eating eggs, and even students who come from houses where they don't normally eat eggs, they want to eat more eggs. It has been shown, and it has been due to work of your work basically, and others like you who have been actively campaigning against such impositions, such scientific impositions. So let me ask Prerna. She has some questions, I think. Okay.
Thank you, Sylvia, for the engaging talk. I've um I've been following your work for some time, and it, I'm really commend the the tremendous efforts that you've been putting in campaigning against and talking, raising your voice and your opinions against some of the uh, rampant eh, propaganda that's being spread against meat eating practices, so to say. So, and and of course the other things. Um, I really wanted to ask you about the joint letter that you had drafted in response to a study which was led by the International Food Policy Institute, which the study which they conducted said that meat eating puts women's lives at risk, and in the letter that was drafted, there was uh, it said that vegetarian and non-vegetarian are not exactly scientific categories. So I'm really wondering if you can expand a little bit on that.
Yeah, sure. Yeah, I mean, so basically that study that IFPRI put out had a lot of issues with it. Uh, for example, it was funded by Bill and Melinda Gates Foundation. The study itself, the project itself was by them, and then they also had the evaluation supported by the same organization. So clearly there was conflict of interest. And if you look at the groups that they looked at, the people who identified as non-meat eaters, only 4% had eaten eggs, during that period of study. So even those who, identify as meat eaters were not consuming adequate quantities of, meat. And that is because, again, people are scared to disclose because it comes from this state of Uttar Pradesh where you can be killed for your food choices. And access also, there's been cattle slaughter bans in some of these states. But yeah, just labeling someone as vegetarian and non-vegetarian, the reason we said it's non-scientific is because you have to look at multiple factors. You have to look at um, for example, you, Prerna, you could identify as vegetarian, and I could identify as meat eater. But you, if say you're coming from a privileged caste and class group, you have access to a lot of different foods, you have better education, you have better incomes, then obviously your diet is going to be much better, even if you're not consuming meats. And if I am coming, say, from a Dalit community, I'm being oppressed, I'm not being paid wages, I'm my children are not having access to proper anganwadis, I don't have access to health services, then obviously my health outcomes and my nutritional outcomes are going to be much different. But also, if you look at the composition of dairy, it is very similar to animal source foods. It's closer to say a banana, it's closer to say beef than to a banana, the dairy, in terms of the fat composition, the protein composition, the vitamins, minerals. So calling it as creates an artificial difference, saying vegetarian and non-vegetarian, whereas actually these foods are across a spectrum. So dairy is definitely an animal source food. Technically, you cannot, it doesn't come from a plant, so you cannot call it vegetarian.
Okay, interesting. What your response also making me think is that you're in a way, because the responses um, might be so affected that even certain caste eat certain oppressor caste people eating non-vegetarian might identify as vegetarian. And so what might happen is that, I mean, what might happen is that a certain oppressed caste people might get categorized as non-vegetarian. Is what you are suggesting, right?
No, I didn't get your point. Tell me again.
In the sense that, in the sense that um, even if the oppressor caste people eat non-vegetarian food, they might not in the responses they might
Right,
just
right.
identify as vegetarian. Yes, that's the
I mean,
uh,
that's well known. If you're eating, if you're coming from a so-called pure vegetarian family and surveyor comes to your house, you're not going to say, "Yeah, when I got with friends, I have beef rolls and chicken kebabs." You're going to say, "I'm pure vegetarian," and that is well known that people tend to underreport their eating to surveyors. And also it depends on the researcher. So if you're as a researcher you go and you're looking disgusted, even when you're asking the question, you look like you're going to throw up and it's certain mention of certain foods, then obviously people pick it up and then they are not going to say mention those foods. And that is well known, the researcher prejudice. And unfortunately a lot of the research is done by researchers who identify as vegetarian, which is very unfortunate. So one cannot trust the outcomes of a lot of this research.
okay. Thanks. And now I'll go to the YouTube chat and ask you a few questions from there. Um, Saptarshi Paul asks, what are the mechanisms via which the government may influence the diets of people outside this demographic? Those who are eating whatever their caste, religion, region, etc. dictate. Uh,
So yeah, I mean the government can definitely bring in policies to reinforce this idea that India is vegetarian, and it is doing that. It's how the research is interpreted, and the things that are picked up from the research. For example, the research shows that vitamin A deficiency, there's a problem in the country, and many of the animal source foods are a good source of vitamin A. But then a bureaucrat might take that data and interpret it to say that Indians are mainly vegetarian, therefore we'll give them only fruits and vegetables, or Indians cannot afford meats and eggs, and therefore we'll give them fruits and vegetables. So it's again interpreted. The research is interpreted in different ways by the policymakers. And like I said, organizations like ISKCON, Akshay Patra, and many of those ideologically driven organizations have a lot of power. Corporates have a lot of power to dictate decisions made by the government, and they implement it. Like for example, they might decide what is give the kind of food that is given, say in public institutions, what goes into the textbooks. Like you have the national education policy, which is again pushing for a very ideological kind of food policy. So the government can influence through all these means. The information that goes into textbooks is very important because students pick this up, and whole generation of students have been given wrong information, which we are seeing repeatedly in schools and colleges. Children have very little accurate information being given to them about a lot of issues, but yeah, specifically about nutrition.
Thank you. And even when it comes to textbooks and books that students read at school level, if they don't see the foods that they eat in their houses, especially Dalit and Bahujan students, if they don't see those foods in the textbooks, they don't really identify with, and there is a sort of an alienation that happens over there, right? Uh,
Absolutely, yeah.
just a
In
thought,
fact,
yeah.
in fact, there's a lot of shame that children are made to feel right from a very young age. We know mothers who say that they don't pack the food that they cook at home for the children to take to schools. We've seen that even in the older education institution. I'm sure in IIT also it's pretty rampant. IIT is in the news for like all kinds of wrong reasons. One of them is this, extreme food fascism that is being imposed on the students. So it also, like we've spoken to children who say that our teachers told us that vegetarian is good for your brain. Meat is only good for your body. So if you want your brains to develop, then eat more of vegetarian, which is completely unscientific. It's nonsense, because you need fats, you need proteins, you need very good vitamins, minerals, again, which then comes from the nutrient dense foods. For child's brains to develop, you need for the, blood, bones. For heights, better heights, you need animal source foods. For better pregnancy outcomes, for preventing illnesses, you need animal source foods. So yeah, the educational institutions are big spaces for this kind of wrong information.
Right. I'm also thinking about smells and foods
Yeah.
associated with foods. So yeah. Okay.
The vegetarian fragility syndrome.
Yes.
Yeah.
Amarkant Thakur asks, could you please comment briefly on the phenomena of urban neoliberal veganism, and how adequate are these vegan substitutes of milk and meat, even if they're not sustainable?
So, I mean, if you look at it from a nutritional or medical or clinical point of view, vegetarians can have, you know, adequate nutrition if they have foods from the different food groups, and also like the, milk, dairy, butter, ghee, all of those can help them to get most of their nutrients. Plus, like, nuts and pulses, especially sprouted pulses. So nutritionally, a vegetarian can actually meet the requirements. But if you look at vegans who completely eliminate all kinds of animal source foods, it's medically impossible to meet their nutritional requirements. So it is an unhealthy food fad. It is unhealthy. In fact, even the most ardent vegans would not recommend it for children or for pregnant women or feeding women. In fact, in some countries, veganism, imposing it on children, is actually banned because it has so many nutritional outcomes. And you can only have veganism for a period of time by having, supplements. Um, Again, like for example, B12, the only known source of B12 is animal source foods. So definitely B12 deficiency is expected to be quite high among people who opt to have a vegan diet, and a lot of them actually cannot sustain it for prolonged periods of time.
Right. Okay. And uh, moving towards another question, Akshay Sawant writes, thank you, doctor, for the excellent talk. By showing practices in nutrition policy, you highlight how science practices are not scientific and are inflicted with caste, identity, value system, and ideology. Could you could you spend more thought on the practices of science in general in contemporary India?
Uh, the, in
It's
the
a huge.
You can answer that, Prerna.
No. Please take it away.
Yeah, I mean, I like I said, science is not. I don't think scientific basis is science is the basis for many of the decisions in the country. Unfortunately, um, neither is you know neither are constitution principles the basis for decisions in the country. Neither is social justice. Neither is equity, nor is democracy. Uh, like I said, overarchingly, it's caste, politics, ideology, which decides, what happens in the country. So I mean, we are seeing that with education, the decisions around education. Like if you visit some of the government schools, it is, no child should have to study in those kind of situations. There's no access to teachers. There's no access to toilets. There's no access to water. There's no access to privacy. How do you expect girl children, who are having, who are menstruating, to be able to go to school and have a decent space to, change their sanitary napkins? None of those are important uh, because I think caste operates so strongly. The idea that Dalit, Adivasi, or OBC children deserve the best of the country's resources, deserve the best food, deserve the best education. I think that's not there. It's sometimes seen as a charity. In fact, I've heard people make comments like, um, these children are beggars, they can't be choosers, and that food or education that you give to the children from these communities is a charity. But it's not, it's actually a legal right. If you look at nutrition, the food that is given as part of the midday meal is a legal right of the child, but that is definitely not being implemented in spirit, in practice, or by political will, except maybe some states. Definitely there are some states which invest in children, so it's not across the board, but yeah, in principle in many of the states that's what's happening.
Right. Okay. Um,
So questions.
yes. It- you've written quite a bit about caste, and how caste operates within the medical community. It, could you spend some time talking about it in your experience?
Yeah, so I mean, caste can operate in many ways. It can operate within the health system itself. It can operate within medical education, and also, of course, in the way the health system itself, responds to the larger health-related issues. So within the health system, like again, we did a study on this uh, during the pandemic. So you have the health workers within the system across the spectrum. You have, at one end you have the mostly dominant caste doctors. At the other end of the spectrum you have the people who are cleaning the bodies and who are handling the dead bodies, who are handling sick patients, who are handling excreta, handling waste. You have the municipality workers, you have the people who are sweeping the streets and also handling a lot of the hospital waste. um, Again, mainly women from the Dalit communities who are facing huge amounts of structural kind of discrimination. They face both gender and caste based discrimination, harassment, abuse. They face a lot of occupational hazards. In fact, they face a lot of labor law violations. And very often this is not visible, so we actually call them the invisibilized frontline workers. So though they are exposed to the same risk, say as a doctor, or they they work the same hours, they give the same amount of effort, they put in the same amount of time, their rights and their needs are never visibilized. It's very often that comes from a very casteist kind of structure within the healthcare system. And even within medical education, we do have some students who come in through reservation of affirmative action, who are facing a lot of discrimination. And in fact, if you look on social media, there's open bullying and harassment because of caste, and also increasingly Islamophobia, gender-based harassment, like the case of Dr. Payal Tadvi. She was a tribal Muslim doctor. She had actually approached all the systems, trying to access justice. She faced so much of structural bullying that she actually took her life. So there is actually very little social justice within these educational institutions. And I think it has to be talked about. Doctors have to be called out and also need to be penalized. And yeah, not just medical. I think there are a lot of these higher educational spaces where discrimination is rampant. Very little efforts to address them. But also looking at the healthcare system itself. Like I said, a lot of them are based in the urban areas. They're very, corporate, commercialized, centralized kind of healthcare systems. So, like, say, someone who's living in a rural area, someone who's a daily wage worker, someone who, because of her occupation, uh, faces discrimination within the systems. For example, if someone is doing, say, commercial sex work, she's, doing sex work for money, she comes into the health system. Someone who's say transgender, or someone who cannot speak English, or who even doesn't have money, the way the system treats them is very different from, say, a English speaking person who can pay money. So there is a lot of discrimination that operates. um, Policy is also discriminatory. Like we saw during the pandemic, there was an expert group that is making decisions. They, either converted a lot of the public hospitals into COVID facilities, which means that all those people who are accessing these public hospitals lost access. So you have HIV patients, TB patients, senior citizens, people who had non-communicable diseases, who really struggled during the pandemic because they were dependent on the public facilities. There's also very little investment for human resources, for infrastructure into the public health system. And we know that wherever there's good public health system, then it's more egalitarian and more accessible and more comprehensive. But now with, like, say, public-private partnerships and with health insurance, healthcare is becoming more and more fragmented. There's a lot of cherry picking, and the people who need these systems the most are the ones who are falling out, getting left out.
Okay. Um, I think that's all. And thank you for the talk and for this conversation. I gather that there is not uh, for the grievances that uh, people from the Dalit and Bahujan community have against the systems that they find themselves mired in. There are very few people who actually do speak up, and who are able to, who have um, uh, the who have the tools to, who have the means to. And thank you for that. I see your activism as hugely inspiring and encouraging. Okay, thank you.
So, hi. So I had one question.
Okay.
Yeah.
Yeah. So in IIT, so I studied in IIT Kanpur, then Madras, and in Bombay. So IIT Kanpur had like separate eating spaces. Like they had earmarked like vegetarian board. Like only vegetarian students could actually sit there, and if anyone other than vegetarian went there, there was a penalty that was imposed. In IIT Madras, at one time, they had separate washing spaces for students, and most of the time they use this argument that like it is because vegetarians are like the victims, like they cannot take the smell, they will vomit if they get the smell of non-vegetarian food like meat. And in IIT Bombay, we recently filed an RTI asking like, is there any actual policy that shows that the IIT is actually having separate kitchens or separate eating spaces for different dietary preferences? And for the RTI, they said that no, we don't have any of this. But in practice, when you look at hostels, there are spaces where they serve only vegetarian. Only the students who eat vegetarian go and sit there. And what was strange is we found data that showed that in one of the hostels, there's a fine that was imposed on the caterer because they cooked the vegetarian food in the non-vegetarian stove. So like it's not even the food or the vessels, it's even using the same stove as, which is like in IIT, which claims to be the scientific institution of the premier scientific institution of the nation, is like openly like doing the most unscientific thing. Yeah, it's basically like it's basically untouchability. Like there cannot be any contact between these like two different dietary, the people who eat this different kind of food. So how is how can this be combated? Like,
Yeah, first of all, the it's only a minority that are identify as vegetarian. So the most of the facilities should be keeping in mind what the majority prefer. And so if you look at eating practices, then a majority are people who eat meat and eggs and fish and all the other kinds of meat. So their eating preferences is what should be given the first priority. And anyone who has objections to that, they can make like alternate arrangements. It should not be that the minority is getting the uh, priority in terms of arrangements, and the majority have to adjust to them. So it has to be reversed. So if, like, say there are 10 people doing something and I don't like to participate in that, then I choose to eat separately. I can't say that I'll eat in the hall and the other 10 of you eat separately. So I think that whole structure has to change. And secondly, like I said, vegetarian is not all that pure, because they also consume foods that come from animal sources. So I think it's important to remind them of that milk also has the same kind of fats and blood cells and contaminants or bacteria or whatever it is that they think other meats have. And it's I think uh, the science of it has to be brought in, because they also make it appear like vegetarianism is more scientific. But I think that is a myth that has to be broken by saying that this is more nutritional, this is more cultural, and this is more traditional. And in fact, institutions which call themselves scientific shouldn't be propagating this kind of thing, and they should also be challenged on multiple fronts. And I think science is important because the um, propaganda is being pushed currently as science. Like I said, a lot of children are being told that vegetarian food is better. So therefore, when they go to colleges or institutions like IIT, they're already feeling shame. They're already feeling that we are eating unhealthy food, we are eating wrong food. But once people feel pride in the food and they say, no, these are foods that will make us taller, it'll make our pregnancy outcomes better, it is more scientific, then people will be able to demand it, I think, with much more authority.
Also, there has been a recent trend of, instead of using this pollution and purity as a means of segregation, they use the idea of that this is more environmentally friendly, and they will try to guilt you into telling you should see videos of slaughterhouses and how these are operating and you are killing innocent animals. Like, there is this opposite way of attack on meat eaters,
Yeah.
that guilting them into like feeling bad about what they are eating.
Yeah. So we actually spoke to farmers about this, and the farmers said that for us, giving up our cattle for slaughter is very important part of the economy for us. It doesn't mean that we don't love our animals. We, of course, they're not like cuddly teddy bears or stuffed animals, as most of the urban elite relate with their animals. For the farmer, it's part of his life, it's part of his family, it's part of his culture, it's part of his economy. But also giving it up for slaughter when the animal is sick, or when the animal is old, or the animal is unproductive, is an important part of his life. So the way humans and animals and plants have coexisted, a lot of people who are living in the urban areas, they're very disconnected from that. And unfortunately, they see some of the worst videos, which they also need to look at who is bringing out these videos, what is the larger agenda of some of these, who's investing in all of these, what is the corporate stakes in promoting these kind of messages. Again, when you go on a plant-based diet, it's not exactly ethical, because first of all, you kill a lot of small animals. You kill the rabbits, you kill the the small animals that are grazing in the fields. But also, uh, the like, for example, when the West went vegan, the exports of cashew nut and almonds went up almost 35%. because of which there's a lot of exploitation of countries like India. The local crops get destroyed. You bring in a lot of these cash crops. A lot of air miles and ship miles are lost in transporting some of these foods to different countries because they want to be ethical. They think they're doing something for the climate. But the best way to support, climate is to cut down on automobiles, is to cut down on digital technology, is to cut down on industries, to support your local economies. Like instead of, you want kiwi fruit flown in from some other country, get papayas from your local trees, get guavas from local trees, support the farmers, buy meats that are, produced locally. That's more eco-friendly and that's more sustainable. And uh, ethics sometimes can just be what you imagine it to be. It's important to also look beyond that. Look at this whole idea of plant-based foods from a existential perspective also, but from a nutritional perspective, and look at ethics, beyond what your game changer, videos are showing you.
Thank you, ma'am. That was like an excellent response to these allegations or these attacks that the meat-eating students who are facing this. Also, like how to create agricultural land for such a, if everyone turns vegetarian, the amount of destruction that will cause. And because humans can only consume certain kinds of plant food, it's not like we can eat everything from plants. And like how animals can actually transform the plant waste and convert it to proteins that we can consume. So like people
And
just,
also, a lot of the the best tastiest fruits and vegetables are what is grown with animal manure. So you're not that pure, as one imagines. All of these are interconnected.
yes, ma'am. So I think we can conclude the session. Thank you, ma'am, for spending this time and telling us about the issues in how the policy, which decides the nutritional status of the country, is being formulated by people with a clear agenda, and how they are imposing vegetarianism on people and how it is affecting the nutritional outcomes of the nation. And we hope to meet you in person when you come to Mumbai, ma'am.
Yes, definitely.
Thank you, ma'am. So I
Thank
think
you.
I'll stop the live stream.
Thank you, Surya.